This is Dr. Bunkis, Orange County Plastic Surgery in Newport Beach, California. Today we're going to be doing a brachioplasty, and this is the patient. And she has lost 100 pounds after a gastric sleeve procedure, and she has this enormous excess of skin. She has a little fat in there, and first we're going to suck out a little excess fat. But the main part of this operation is going to be to remove this extra skin, and this procedure is called a brachioplasty. And the incision starts down underneath this wad, goes in the inner part of the arm, so that when the patient puts their hand down, the scar remains on the inside of the arm. You can't see it from behind. Obviously, I won't be able to show you her after picture today, so I'm going to show you a picture of a similar patient that I did recently. And this is the previous patient that I saw. This lady lost about 60 pounds, and you can see this excess of skin. And the after picture is taken about 3 months afterwards, and I put it that soon because I want you to see what the scar looks like. It's not an inconsequential scar, but eventually these fade and people walk around with short sleeve shirts and they're not bothered by it. But this is how we do brachioplasties in Orange County Plastic Surgery. Let's step in the OR and finish the case. The operating room now, and you can see this massive amount of skin that she has, and it's about 1.5 inches thick, 2 inches thick. I'm going to first infuse the arm with local anesthetic and water. It's called tumescent solution. We're going to suction this before we cut out the extra fat. And this fluid cuts down on our blood loss. And makes her more comfortable when it's over. And when the fluid's in, we just put in the liposuction cannula and suck away. Can I have and this is just standard liposuction like you've seen me do many times before. And this just thins the flap. And then when we're cutting out the excess skin, we're just cutting out skin. We're not cutting out any deep tissues, and it expedites the healing. We're starting the incision as marked, and we're just going through the skin. And once we're through the skin, then the rest of my dissection is going to be with the cautery. You can see how floppy all this is. Now we're going to continue with the cautery machine. And you can see we're just going under the skin, and this is the layer that we're going to take off. We're elevating this flap now, and you can see down here all the little holes. It looks like Swiss cheese. That's from where we did the liposuction and took out the fat. And I'm just going above this layer that was suctioned. I'm not going all the way down to the bone, just to preserve some lymphatics and blood vessels. And you can see what a big flap we're raising. And this is what we're going to cut off before we close it. This is the skin that we have removed. And I can tell you that I've done some tummy tucks where I haven't taken more than that off from one side, but this is a large piece of skin for an arm. And then once the extra skin is off, we get hemostasis, it's nice and dry, and we just put it together with a bunch of towel clips and then replace those with sutures. And this just temporarily helps me line it up, helps me see which way it's going to close. We line it up so we don't end up with a dog ear at the end. And you can see I could have taken some more out of there, but if you do, then you kind of constrict the blood flow to the arm. And once these are in, if I like it, I just start sewing. The arm is now lined up. We're going to put a row of absorbing deep sutures to pull the edges together. And as I put enough of these in, I can take these towel clamps off. And then the final suture will be a different suture in the deep part of the skin called monocryl. Okay, we're now just finishing up the skin closure. You can see the deep sutures are all in. And this suture is in the skin, in the deepest layer of the skin. It's called an intradermal suture, but there's nothing sticking on the outside, so she won't have little cross hatches on her incision when she's done. And as we discussed earlier, at first it is a little red line, and it's noticeable for about 9 months or so, and then after that, especially if the patient puts silicone on their incision, usually those things are hard to see. And then we'll do the same thing on the other side. We're all done now. We've done both arms, and you can see the incision runs from the armpit to the elbow. The skin is bunched a little bit because that bottom side is way, way longer than the top side, but within a month all those puckers will go. And you can see the other side has been done as well. And now the circulating nurse is going to put on some surgical tape on those incisions, some cotton, and the patient goes into a garment.